To help juniors improve their clinical diagnostic skills, Charmaine needs to come up with case exercises for them to practice on. Previously, she used emails to communicate with her professors for case vetting. But recently, she has been told by her professor that she can now upload her cases to MedSense directly. Her professor will then vet the case on MedSense as well. Charmaine is delighted that her workload is eased to a great extent and could not wait to try out this new application. During her lesson break, Charmaine opens the laptop and heads to the MedSense website. As this is her first time using MedSense, Charmaine does not have an account, so she proceeds on to sign up. Here, she inputs Charmaine as a username. But she was informed that the username was already taken. She changes it to Charmaine94 and set her password. She confirms her password and was informed that the two passwords she entered do not match. She corrects this and selects her school NUS and academic year of study. Charmaine proceeds to sign up and is brought to the student's homepage. She notes that there is a section displaying the cases that the user has uploaded, which are currently empty. First, she uploads a profile picture. And she proceeds on to the homepage. Charmaine is reminded the purpose of creating a MedSense account to upload a clinical case for her juniors. She looks through the navigation panel and clicks on the Case Upload tab. Next, Charmaine is brought to the Case Upload page, which displays the case template. She familiarizes herself with the structure of the template and prepares to start working on her case. The title for her case is Madam Chuan. She then chooses the beginner difficulty level, medicine specialty, and the respiratory subspecialty. She adds the case scenario. Madam Chuan is a 67-year-old lady, ADL independent, community ambulant. She presents with a 3-week history of progressive shortness of breath that is worse on lying down. She selects breathlessness as an approach. Next, she proceeds on to add the first question. Which of the following best differentiate cardiac from respiratory causes of deaths? No here. Charmaine decides to make it an MCQ question. With 6 options. Previous smoking history of pneumonia, hypoxemia, respiratory distress, expiratory rhonchi, and elevated jugular venous pressure. She checks the last two options to indicate that they are the correct answers. And decide to set a time limit of 60 seconds. She saves her progress and proceed on to the next question. For the second question, Shami enters the basic laboratory studies performed by the in review. After finishing the stem, Shami feels that an image of the patient's chest X-ray will help students understand the case better. She tries to attach a relevant X-ray image to the case. Afterward, she enters the question. She proceeds on to fill in 6 options: nab-salbutamol, PO aspirin 100 mg OM, pill morphine 5 mg PRN, Q4H, refer to cardiology on call, transfuse 1 pint PCT and transfuse 1 pint FFP. He checks nab-salbutamol, PO aspirin 100 mg OM and PO morphine 5 mg PI2-4H as correct answers. She also set a time limit to 60 seconds. And she doesn't have reference to F or question, she inserts a takeover message. It's important to differentiate cardiac from respiratory causes of dyspnea. And proceed on to submit the case. She's informed that the case has been uploaded and will be released once the professor has vetted it. Dr. Alex Lim is a senior consultant in the Department of Respiratory and Critical Care Medicine at Tan Tock Seng Hospital and a clinical lecturer at NUS Yong Lu Ling School of Medicine. During his lunch break, Dr. Lim opens up his internet browser, being an avid user of MedSense. He has saved medsense.io as his homepage. Dr. Lim keys his username and password and logs in. Upon logging in, he notes that he has a new case uploaded by Charmaine94 for vetting. Since he still has 20 minutes before the end of his lunch break, he decides to vet through the case. He is brought to the case upload page with a case template that's already filled with what Charmaine94 has submitted. After he read through the existing case scenario, he changed the answer to the first question to apnea and hypoxemia. Then he checked through one last time before making a submission. He's informed that the case has been successfully released to the medical students.